Chair Pintar. Vice Chair Kroll. Member Barrett. Member Bagwell. Member Bonkowski. Member Chiomi. Member Furlong. A quorum's present.
I would like to say that as the old guy, if I get up and leave in the middle of something, I've got a purpose and I'll come back.
Naomi got to preside. Motion for approval?
I move to approve the minutes of the Carson City Board of Health for August 15th, 2019, as presented.
A motion and second has been made. Is there discussion? Hearing none. All in favor, say aye.
Aye.
Negatives? Nope. Minutes are approved. All right, I guess it's my report. Couple of things, or three things actually, that I wanted to talk about. I don't think anybody, well, to some people's surprise, flu season has begun. It's actually, I'll direct you to that kind of tiny slide up there. This is our latest report that is produced based on the influenza-like illnesses, which is how we classify flu visits, ILI visits, you'll see in the upper left. The top line that you can't see real clearly is where we are this year to date. The red line is last year.
Wow.
So we're considered in the red detection level. I also want to point to the second blue box, which is also hard to see, but the numbers of people who are immunized. I think I've mentioned that about 50% of Carson City residents do get flu immunizations, which is wonderful. It's above much of the rest of the country. In Carson City, about 14% of those flu vaccines come directly from our little old health department, which is maybe 3 or 4 people at the most out there poking and soothing tears occasionally. That was about 5,400 vaccine, and of those, nearly half were to school-age children. I bring that up because you will see on that box that most of the visits and most of the influenza is in that population. So it's a population that our health department has been quite successful at doing, at coordinating, especially with the primary care providers. So yay pediatricians, because they're the other ones doing it. But I also want to mention this year we're on track to have 70-something events, wasn't it, Carrie? And much closer to 6,000 flu vaccines being delivered. And as I say, all of this with a staff of 3, a few volunteers, and some people that they corral in the hall and say, come to the clinic with me. I need you.
Can I make a comment?
Please.
I agree with you. I think that the health department is all powerful because it appears that they've been able to relocate Lake Tahoe so that it is entirely in Nevada.
Well, yes, we do that.
That's
But are you
great.
talking
I
about
appreciate that.
that blue blob? That's not Lake Tahoe, that's the 4 counties.
Really?
Yeah.
It's like Lake Tahoe from here.
Dr. Pintar,
Question.
I have a question as well. Oh,
Real question?
yeah, real question,
real
not
question.
a silly Lake Tahoe question. So did I understand you to say that the vast majority of the 5,400 vaccines that you provided were in school-age children? and yet
44% of those were in the 3 to 18-year-old crowd. Which
And
we
yet
consider-
that's still the highest. And so why do you think that is?
Because they're little germ carriers.
So the success of the, I mean, you don't think that speaks to the success of the vaccine? You're not making that analogy?
No, I'm making the analogy that is the group that is most likely to get ill. And so our efforts are successfully aimed at immunizing that group. I'm afraid it would be much higher.
And do we know, it's very, I mean, it's impossible to read even with
I know.
cheaters. But what percentage of that age group do you think we get vaccinated or we reach? We as a health community in general, not just the health department. Would you hazard a guess?
Jeannie? Or she's not Jeannie. Carrie, what do you have? What's your idea?
It's truly a Ronnie question since you runs the clinic.
Well, I can speak a little bit to it, that our school-located vaccine program does get bigger every year. Having said that, I know we don't immunize half of the kids that we go to each school in the area, and we don't immunize half of those kids. So private practitioners are responsible for the other half, so to speak. But I think we're close. Well, what would you say, Ronnie?
Well, I was going to say, I wasn't going to make a guess. So that would be information we would need to provide to you with
Okay.
the number of children in, because this is the Quad County region, so we would need to provide you information on like the number of children in that age group, the number that were vaccinated. And then I don't know if our epidemiologist would be able to provide us or not information about those that have the ILI illness, have they been vaccinated or not? Because there's still a large percentage of the population that is not vaccinated. And so that could also be part of what accounts
Right.
for
And just because you
some
get
of that.
vaccinated doesn't mean you don't get the ILI illness. I also get that. So,
Right.
It's just, it's curious that age group, which makes sense, is the highest age group, and it seems like we ought to be redoubling our efforts to try and increase the number of vaccines in that age group, given that the likelihood is that it'll go from that age group to the old people like us,
True.
So-
Very, very true. And that, I think that it has been the plan for the past, how many years have we been doing the school-located vaccines? Not all that long. But that's been a big part of the effort.
So I can take that one. This is Nikki, for the record. So we started the program when I started in 2013, and that was under a grant. And then the grant went for a couple years, and we decided to, as a department-wide initiative, we decided to continue with the initiative because, number one, we can bill. And so that's now how we run the program. And so this program is not ran with grant funds at all. We do it all on revenue. And we do realize that it's important to get out into the schools and get those children vaccinated, while they're in school. So we'll continue to run this program, and because we see the value in it in getting those kids vaccinated. And this year we were able, this is a Quad County effort. This year we did bring on Lyon County. As we know, these other counties migrate into Carson City for different things. So in a sense, we're protecting our community also.
Sure.
So do you think that, is insurance a barrier? Why do you think that parents aren't going ahead and having their children vaccinated at school? I mean, they don't have to pick them up, they don't have to get a doctor's appointment. What's anything? I mean, but all insurance companies cover vaccines, is that correct?
I don't
Or does it
think-
hit their deductibles?
I don't think insurance is a barrier because with this age group, if they don't have insurance, then they're eligible for the Vaccine for Children's program. I think that some parents may not like the idea of having their kids vaccinated at school. And I also think the movement of parents not wanting children vaccinated also has
Impacted it? Mm-hmm. So we have to maybe do more marketing and more messaging or
and I think we
some
also
way to communicate with all the parents or something?
And we also run up against it's also what we're seeing is sometimes the beliefs even of the teachers at the schools. And so we're working through a lot of this. So,
As I say, the program has increased in size every year. I would agree, not as much as I would like to have seen, but, and you're right, I think we need to do more marketing, so as you say.
Maybe we can do that on one of our joint school board meetings to talk
That would be
about
definitely something
vaccination
to
in
put
the
on the
schools.
list.
Yes, it's an idea for our.
All right, I have a couple of, I wanted to mention a national recognition that two local healthcare organizations received. The Immunization Action Coalition is a CDC-supported organization that supports influenza, well, immunizations in general, but influenza vaccine among healthcare workers. So organizations obtain honor roll status, national honor roll status, by getting 100% of their healthcare workers immunized. There are only 7 such organizations recognized in Nevada. 2 of them happen to be in Carson City, Carson Tahoe Hospital and Eagle Valley Children's Home. So I was pretty proud of that. And last, and certainly not least, speaking of immunizations, Immunize Nevada is our statewide organization that champions vaccines among all age groups. They have some awards that are given out, and our department was very lucky to receive nominations and/or awards in a number of areas. I would like to recognize at this point the nomination for Outstanding Community Partners. If they could come and stand by Nikki, I'd appreciate it. That would be Carrie Rue, Jeannie Freeman, Jessica Rapp, Tony Orr, Lauren Staffen, Mary Ann Garvey, Jennifer Allen, Julie Pomey, and Cindy Guerrero. They were nominated as Outstanding Community Partners for Immunize Nevada.
Oh, wonderful. Where's Rachel? We should have had a picture.
I also want
can I
to-
just make
Yes.
a comment here? So as we're talking about our school located program, these
They're
are
the
those
ones.
individuals that, and Carrie starts planning for this in the spring before individuals start going home or taking their vacations for summer break. So this is almost a year-long planning process.
Yeah, another nominee that I wanted to recognize is Miss Susanna, whose name is not one of my best pronounced things. Susanna is in our front office at the clinic, and she is our immunization champion there. She makes sure that she checks all the immunizations of the kids coming in. She forecasts the vaccine. She lets parents and other patients know that they're going to need vaccines, and we really appreciate her efforts in getting the families who come in fully vaccinated. So thank you, Susanna. And we had a statewide winner. Our Miss Ronnie Gallus was nominated as the Outstanding Immunization Champion for the state, and she was the winner. So I think we're, all right.
Yeah. Yeah, come on, get a picture.
Bring your
You want us to come down?
reindeers.
Picture with them?
Go down.
I'm going down, do a picture with them. Come on, you guys. We do good work. We need to celebrate. Congratulations, you guys. Yeah, that was really wonderful. Uh-oh, we'll see how Nancy does.
I know.
We had some prior city managers that were slightly challenged.
I know, this is a lot of pressure. All right, 1, 2, 3, immunization.
Shoot 'em up.
All right, I took 3 just so
Thank you guys so much for all your good work. Thank you. He does. He's lying. Might wake us up.
Then while everybody gets to their seat, if I could just make note, this influenza activity report is actually developed weekly, and it is on our website, so you
Get
can
healthy.
gethealthycarsoncity.org, so
GetHealthyCarsonCity.org.
you can look at it on a weekly basis.
You don't want to be too depressed. Yes, I'm sorry. Thank you. I do need a motion.
I move to accept the health officer's report as presented.
Motion has been made and seconded. Discussion? Hearing none. All in favor, aye? Aye. Opposed, no? Motion carries. Thank you. All right, we will go on to item 34B, Vitality Unlimited report. As you probably remember, by contract, Vitality is asked to give a twice-yearly report to the Board of Health.
You're on.
Can you hear me?
Yep.
Hi, I'm Judith Rickett-Stuckey. I'm the director of the residential program that's housed at Health and Human Services and the CCBHC that is over at Nye Lane. And so our report is pretty self-explanatory. I think the difference in this quarterly report is that we've increased the amount in the last two columns that we're treating more Carson City residents here in Carson. For a while, the trend was to send them to Elko, but that's kind of turned around in this last quarter. So, which means they're not running as frequently. You know, it's easy for them to just get on the elevator and leave and run down the street to their house. And so they were sending them up to Elko, those that were court-ordered, so they couldn't leave and get home so quickly. But we've kind of tightened up and did more training, and so we're engaging them a little more, and they're staying better. So we're happy about that. I really wanted to also give you a report on our CCBHC, so I brought a couple key people with me.
Hi, I'm Winta. I'm one of the LCSWs that work at Vitality.
Maybe instead of speaking in initials, you could speak in words, because those
They don't know what
initial.
an LCSW
No,
is.
no, CC.
Certified Community Mental Health,
Thank you.
Behavioral Health Clinic.
Thank you.
I'm sorry.
I know, it's easy to speak in
Yeah, we get
acronyms.
so used to that. We call it our VIP program for Vitality Integrated Programs, because we've integrated all levels of care.
There's acronyms for everything.
Yes. I'm sorry, reintroduce yourself.
My name is Winta Haile. I'm a licensed clinical social worker at Vitality right now, the CCPHC.
Clinic,
The
the
clinic.
mental health clinic.
So basically, we started up in February in Carson City, and so since then it's been in the beginning started off slow, like a slow trickle, and now everybody's like running to us. So it's actually really nice, and we're offering a lot of services. If you guys would like me to explain some of the things that we do.
I would.
Okay, good. So some of the things that we do have are we have two psychiatric nurse practitioners that also do medication management, telemed, and so they work with people in Elko, Dayton, and Carson City.
Are they here or there?
They're here. They're here.
They're Carla Farnsworth and Ben Cadis. And Ben specializes in children, and Carla specializes in adults and geriatrics. So we have a full spectrum of age that we treat.
Yeah, and they're wonderful. Everybody who comes in usually like sings their praises. And usually they have to get, well, not usually, always, they have to get the person has to get an assessment before seeing the psychiatrist. And so it's actually really helpful to know the diagnosis. And then, so there's a process. And then there's also behavioral health, which is what we do with the screenings and assessments and diagnoses. And with the psychotherapy, it would be, we're hiring, we're adding more people to our group right now, but we have 2 people specifically in the CCBHC right now that we're also adding more employees to. A new one's coming soon, like this coming up week.
The 26th.
Yep, the 26th. So we're getting another one. So that will open up more spots for more people to come in. And then we also provide case management, which we have a couple people that do that. And we have LADCs and interns that are also working with us. So it's
She's talking about substance abuse counselors as opposed to social workers. LADCs are licensed drug and alcohol counselors.
Yes, sorry, more acronyms. Which also leads me to say that we also do substance abuse evaluations, and there's a residential facility that is also down not far from here.
That's what we're here for.
Yeah, not far from here. So there's that, and then there's intensive outpatient, and there's also we do the drug testing, and we do a lot. We have a lot of things that we can provide for the community. And I was actually talking to Misty about it, that we, like, if we weren't called Vitality, we'd be called, like, Versatility, because we're versatile. We would definitely, like, roll with the punches, and we try to adapt to the community. And so we try to provide things that we can for not just the community, but, like, the culture of the community. So everybody.
And on the end is Misty Stewart. She's our office manager at the clinic.
She's amazing.
And so you probably talked to her first. She asks a few questions, kind of evaluates needs, and then tries to get you in within a week to see someone, so you're not waiting for a long time for an appointment. So we might not be able to get you in for a psychiatric evaluation right then, but we can get you in and start you on the paperwork to see if you need a medical exam, the condition of your family, if you need something in social services, if you have enough food, all case management stuff. So we evaluate all the needs that you may have and then refer you to the clinician that can address that maybe before you actually see a therapist. But we try to offer you services as quickly as we can.
Yeah. And we, you guys were talking about children earlier, and we also are trying to work with the schools out here, and so we're doing a lot. We're trying to also invite the community to let us know what they need, so that we can also incorporate more things that the community needs.
We just got our memorandum of understanding with the school system, so we can go into the schools and offer services, because they don't always have transportation to get to us. So we're going to send Winta, because children are her specialty,
that's my
into the
population.
schools.
So for members of the public who might be listening or understanding, how would they access their service? Let's say I have a family member who has a mental health condition who needs treatment. Would they just be able to call?
Yes.
Yes.
They'd call the office, and then
Yeah, they can call the office or our crisis line if it's after hours, and they'll get a hold of us, and then I have a loud voice. No, just kidding. Yeah, so they just call the office, and that's 775. I don't know if anybody needs the number, but 461-0025. And we try to have a program without walls, which means if you don't have medical insurance or financially you can't get in, you can't get in anywhere else, we will work with people so that way they can have the services they need.
And thank you. That was my next question, because are you contracted with specific insurances, or how
We are in the process of being contracted with as many insurances as possible. I know that that's kind of a process, but regardless, if we don't take the insurance, we'll work on a sliding scale, so that way people can get services.
and you're Medicaid certified?
Yes, we
Yes.
are. Yeah.
Right. And what Misty means with the office without walls is we will do Zoom. We will hook you up so you can sit in your own living room and actually talk to a therapist. We will go to your house. We will do whatever it takes to get you the services that you need.
And one of the things we're really working on within the next year is the mobile outreach. So we will be able to do more of that. So,
We're growing.
Thank you. Questions for?
I have a question. So on the residential treatment in Carson City, and I don't know if you have the answer, but can you tell me on the inpatient how much recurrence you have? So are we getting a success and you don't see him again, or you have to see him 2 or 3 times in residential treatment? What are you?
Yeah, I wish to have an
How are we
answer.
doing?
Yeah, I never know when, how many times is enough. You know, some people it takes the first time and other people just keep coming back. I think personally, I had a person come back 13 times before they got it and were able to put 20-some years together. So in all the years I've been doing this, which is a very long time, I don't know how to measure that. I really wished I did. I could patent it and be really rich, but we take
But
them
you don't have any
regardless.
idea
Yeah,
of
whatever
our
their-
clients?
However many times I don't know of anybody that our CEO Esther would turn down, even if we've had them a bunch of times. We just believe they're always worth another try.
And so it's supposed to be a safe community. So if they graduate from the program, we hope to I usually have that thing. I hope I never see you again. But if they come back, I hope it's because they feel safe, and it's because they're not feeling judged.
And we
Yeah,
try
that's
to
really not what my question
yeah.
is. I'm more interested in, do you see that it takes 2 times, 3 times? You have no averages whatsoever to be able to look at our
I
own
really
clients and
don't,
say?
and I don't know of any stats. We know that the success rate is around 30%, and that's high, and that hasn't changed over many years. It stays right around, 30% success rate.
From the first time? From the first
Yeah.
visit?
And so we try to do things different when we see someone. We talk about, we kind of do an autopsy on their treatment before. Well, this didn't work, so let's try, something different. But I really can't answer you. 30% success rate. I don't know how many times it takes. Some people come in just absolutely motivated. They just know that they're ready. And other people leave not knowing if they're going to stay clean and sober,
But just like
that
she says, we'll also, whenever if they do come back, we'll figure out what can we change to make this better for you, kind of. Not like, let's do the same thing and see if it works this time. It would be more of like, okay, what can we do this time that will help you to stay sober?
would you like for us to see if we could come up with some type of a report next time we come in? I'm not sure what that will look
She likes to
like.
do research. So.
Yeah, so maybe, that's something we can look into so we can give you more numbers.
Well,
Thank you.
as an
Interested.
analogy, there's been research into domestic violence. And the average, quote unquote, and again, this is based on many numbers, is that an abused person has to leave 7 times
Right.
before. And I think that that's kind of the number. It's not to say that you're not successful after 1 or 14, but I think what we're interested in is what might that number be and how close is our
Just
local
off the
programs.
top of my head, I think about 3 times in treatment before they kind of get it. And I think that goes back to when they first started, residential treatment in the 60s when it became a big thing. They started out with 90-day programs. And so I think they knew something then that we've kind of gotten away from because of finances and,
Well, I think in essence, that's what I'm after is, would it be better to go to a 90-day program and get success versus keep having them go around the treadmill on 30 days? Are we putting our money to the best use?
right.
Should we see fewer and do 90 days? I don't know the answer, but I'd love it if we had some type of a data point to look at.
Personal
Thank you.
belief is a longer period of time. I think the 30 days that most insurances are willing to pay for, they're just getting stabilized. Their brain is just coming back after being diluted with alcohol and other drugs. They're just starting to think and make better choices, and then we're throwing them out on the street. So I think just physically, a longer period of time in treatment would be far more effective.
I agree.
But insurance doesn't want to pay for it, and they usually don't have the resources. So then we're stuck with trying to find them places to go that are safe. Oh, and we are working on getting a transitional house for women here in town, and we've almost sealed the deal on that. So that's our first step to more transitional living here.
So one of the things I'd like to say too, when people leave residential, the good thing about having the CCBHC here now is we have already got them integrated. So they're doing longer, programs. They may not be staying at residential as long, but they're moving right into a program because they've already,
We try to establish them with a therapist, and so when they graduate the program, they're able to come to the CCBHC and continue their program. I have a client that continuously comes and says, like, it's been 66 days, I'm successful, and it's really nice because he's excited that it's happening. And so I know that more people would be happier if they had a place to go afterwards, not just, you're done, bye. Like, they want to feel safe, and they want to have a safe place to go, not feel judged.
And we have one of the residential counselors goes over to the CCBHC to do an aftercare group. So they have the same counselor that they had while they were in residential, follow them in outpatient, and that seems to be working really well. That's one of the largest groups over there, so they have that extended support system.
Yeah.
So.
Well, thank you very much. Other questions?
You kind of covered the topic I was going to ask, and that was follow-up care after their 30-day stint. And I mean, that's obviously critical because you can't just do 30 days of treatment and say, see you later.
Yeah, we
And
try
so it sounds like you set them up
Yes.
to be able to do that. Relative to Lori's comment, perhaps what you could express the success rate as, I mean, if you say after one 30-day treatment, you have a 30% success rate, obviously that's a statistic you have. But so maybe what you could say is after two 30-day stints, it's a 50% success
Yes.
rate. And after three, it's a 90%. And maybe that could be a way you could express that to us. Because I think
Yes.
that would give us the information.
Great.
And, I mean, it's going to stay at 30 days because insurances aren't going to pay more than that.
Yeah.
And so we know that it would be great to be able to say, let's do 90 days, but you can't be successful if you can't get the funding to do that.
Which is why we try to set them up beforehand with the assessment, diagnosis,
Correct.
and then continued support.
But it, maybe if you express it that way, it'll answer that question and say, okay,
Right.
we know if someone goes through the treatment program 3 times, they've got a 75% chance of being successful. And that would be helpful, I think, from an informational perspective.
Thank you.
Thank you.
Thank you, ladies.
Thank you.
Thank you.
Appreciate it. See you in a few months.
See you soon.
I move to accept Vitality Unlimited's report as presented.
Motion and second have been made. Discussion? All those in favor of accepting Vitality's report, say aye. Aye. Those opposed, no. Motion carries. Thank you. All right, Mrs. Aker has quite a lot to tell us about in her director's report. Hit it.
Okay, for the record, Nikki Aker, Director of Carson City Health and Human Services. So I want to start off with a legislative update, and yes, the legislature is not in session, but we're busy at work already. We've been asked to present to the Interim Healthcare Committee, did that on December 11th. So the 3 local health authorities, Washoe County Health District, Southern Nevada Health District, myself, my agency, the state from the perspective of the State Health Authority, and the Nevada Public Health Association presented, as I said, on December 11th. We discussed how public health in Nevada is set up, and that's under NRS 439. We discussed the challenges for public health in Nevada, and this is as a state. I can take that down. So what we talked about was the inadequate, uneven, and volatile funding for public health, even in the best of times. We talked about our dependence on CDC and other federal dollars for the majority of the core state and local public health funding in Nevada. And we talked about the competition for equally worthy health priorities and the public health crisis of the moment funding. And I think we saw that with the opioid money that was coming down very quickly, and it was that crisis at the moment funding. We discussed how the health authorities are the same and how they're different, our successes in the different agencies and our challenges. What the committee wanted to hear was what policy asks were. We again asked for, and it may not be termed this, but the healthcare committee is familiar with this wording as a public health improvement fund. So in other words, increasing investments in the foundational public health programs and services. You saw in my staff report that Nevada, it's about $7 per capita. We're 50th out of 51. And Washoe County is asking for reform, classic vehicle plate and smog check legislation. We talked about tobacco and e-cigarette prevention and control, including Tobacco 21 with appropriate enforcement. I don't know if you all remember right there at the end of legislative session, there was some legislation for Tobacco 21 that went in, and it was put in by the Altura, I think is who put it in there. And we were actually, as health authorities, glad that it did not pass because of some of the language that was in there. And the committee asked what would be good language to have in legislation of this. We asked for comprehensive sex education reform, immunization and other infectious and communicable disease prevention strategies. There was a bill this past session that got watered down quite a bit and really did not meet the intention of initially what it went for. So we asked for improving access to essential healthcare services, including preventive health services. We asked for health workforce development, particularly the primary care and behavioral health workforce. We asked for addressing social determinants of health via health in all policies strategies, like looking at housing. We asked for improved healthcare and health workforce data collection for public planning and policy making. And specifically what this is looking at is there's data out there where healthcare providers live, but not necessarily where they work. And there was some talk, and it's about having it tied to when they renew their license and that, and things just need to be fleshed out. So when you renew your license, that you're giving that information of where you work, so that we can get a better idea of where actually the providers work. And then support for evidence-based injury prevention, such as gun violence prevention. The presentation is on the state website, if anybody wants to look at it. And I will continue to keep you updated on anything that continues to happen along that forefront.
To interrupt for a moment, this is a point where, as board members, we need to think and transmit to Nikki if there are specific Carson City issues that we would like directed to the state as well. Many of the issues that she discussed will impact us, but some more than others. And so I know that Nikki would welcome our personal input.
So you want me to go?
If you like.
So I guess for me, I have a general question. If we were to look at Carson City and across the entire spectrum of the health department, do we have a number one priority or issue that we all agree is where we should be trying to tackle a goal? You know, I'm assuming each and every one of the divisions has something, but I look at it overall and say, if I were to do a strategic plan or something for Carson City, what would raise the level of health citywide? Is there something we could tackle and really push for?
We were talking about this earlier, Lori and I think we can get there. We right now are so highly grant funded that, we're all working on these grant deliverables and that, but yes, I think we can definitely.
And I think that also is the purpose of our Community Health Improvement Plan, the CHIP, which has, and we don't need to go over that today.
Right.
You're very
No, but I
familiar
have to
with
check.
it, but those are I think the priorities that are more Carson City relevant. And again, if there are ways that we can persuade the state or other stakeholders, to use that term that I don't like, to, join forces with us, I think that's what we're looking for.
And also, Lori, to your point, I think we're working on the city strategic plan, and that's coming up with those that can feed up into the city strategic plan.
Well, I'm just very interested in trying to see if we can change a piece of the dynamic where it's about looking for a grant to sustain employees instead of what is my goal that I need for my community, and then if I can find a grant for that goal, great. But I think maybe we've been, I get all the grants, and I'm certainly the one with the money that likes that, but I just want to make sure we're not missing in our minds that we should be going after health indicators for our community and then find the grant. So I think we're a little bit potentially backwards, and
Well,
I'd
I
just like
think
to
we are
address
trying
that.
to do that. One of the difficulties, and I think at the core, is that because Nevada as a whole, and Carson City specifically, has no base funding, that there's no real way of saying, this is what I want to work on every day, all day, and then when I have a grant, then I can poke at these other things. So the efforts really are to try to create some sort of base funding.
And you're absolutely correct, Dr. Pintar, and that's where, as the state, local health authorities, that's what we're trying to ask for when we're asking for this public health improvement fund. So it's this flexible funding that does not pigeonhole us into a specific project, but it would allow us to look at our community health needs assessments and our community health improvement plans and what makes sense for our community and what can we work on and make a difference within our community. And that's what that funding would be used for, and what we have been communicating within the healthcare committee and to the state. Okay, so moving on, just an update on the funding from SB 263. If you remember, that passed, and that is taxing the e-cigarette or vaping products the same way that they do as tobacco products. So the state is funding the health authorities and coalitions. They say that starting January 1st, 2020, there's no application. The state has told us that we would be receiving $137,088. We had no input on the amount that any of us were receiving. Once we receive the notice of award, we will be coming back to the board for acceptance. The grant is to provide education to youth on vaping and the dangers of vaping. And what we've budgeted to do this first go-around is to look at hiring a contract person instead of adding a permanent person, or maybe look at a part-time person, and that can go in to the schools to educate. We're doing a little bit of that right now, and what we're finding is it's kind of exploding, and more requests are coming in for presentations on vaping. And that, so that will be more to come for the board down the road, but that is what's happening with the SB 263.
So the school district is already inviting you into the school, because you can't go without them. I mean, you can't just say, I'm going to use this money and go to the schools and talk to
They're
the
inviting
children.
us.
The door has been opened. We want to march more soldiers in.
Yeah.
So what has happened, yes, we've been in, giving presentations about tobacco. We just, and I'll give a plug for another program of ours. We have not been able to go in and do our, sex education program until just recently. And, my coordinator, Sarah Johnson, just continues to knock on the door, knock on the door, knock on the door, and she's now in there. She was the one, she presented to you all. She was doing the tours to the health department, trying to, build that relationship. And she's now in the program. And when she's in there, she talks about the tobacco. And now these requests for tobacco and vaping presentations is exploding. And so, yes, we're already in there. So now I want to talk about our reaccreditation efforts, and I'm very pleased to introduce Hayden Cook. You can come on up. So Hayden is our part-time accreditation coordinator. And when I explain this position to him, he is coordinating all of our documentation for reaccreditation. It is not an easy job. Basically, I tell him he's herding cats, and he's keeping us all in line. And he has not been on the job very long, but he's doing an excellent job. He's got a big job ahead of him. And we're very happy to have him. So
Thank you. Our timeline, maybe Hayden, you can tell the board a little bit about what the timeline is for the next reaccreditation. You have to poke the dot. There, yeah, don't just poke it.
So our reaccreditation date is coming up in May of 2021. We have to file for that 8 weeks prior. But we're gonna try and I'm already working on getting a majority, or not a majority, but there's some things that we can work on now, and then some things that we have to plan for and do projects on in the future before we can write up drafts for those narratives. So I'm focusing now on trying to get the ones that we've done QI projects on and things like that written now and drafted up, so then we don't have to worry about them later. And at the very end, we're not struggling to fill everything in, and we can do our best.
And as a reminder for those of the rest of us who don't think reaccreditation every moment, there are 12 different areas that the health department has to prove their worth, so to speak. 2 of them are more specific to governance, and as time goes by in the next year, we'll be talking about the activities that we as the Board of Health need to be intricately involved with. Thank you, Hayden.
Thank you.
Okay, and then I just want to keep you an update on what's happening with the district health discussion. So what has happened is Lyon County is one of the counties that is interested in this discussion. They have applied for 2 different grants. One grant was through the Robert Wood Johnson Foundation, and that was it's a cross-jurisdictional sharing grant to basically research a district health department, what laws would need to be changed, what would need to happen, and then from each county's perspective, what would be looked at. And then they also applied for a HRSA grant for the same thing. So that's what's happening in that area. We haven't had any more meetings other than the Lyon County applying for those grants. So.
I have a question relative to that. Have we as a board taken a stance on whether we want to do this or not? I mean, has this ever come?
It hasn't come up. I think there have been a number of informal discussions, and it hasn't come up because there hasn't been any sort of concrete plan, and quite frankly, there are some legislative barriers that have to be overcome before we could even do it.
Well, I guess my question is, do we know if we even want to do it? I mean, maybe that's a discussion we should have before we start going down the path of trying to change state law. If this board doesn't
Yes,
think that's.
I think that what has happened has been more on her level, staff level, yes.
This is not something that, this go-around, this is not something that's driven by us. This is driven by the other counties. So even if we elect not to be a part of it, it could be that those other counties are going to do it.
I really don't have any issue with what the other counties do. I just am concerned about when or how we make a decision on spending staff time or staff resources on something we may or may not be supporting. You know, not that I'm not supporting it, I don't have enough
We don't,
information.
yeah, I see.
and-
I think what you're saying is we don't know it. We don't know enough yet. And I think we don't know enough yet about the pros and cons. I will say that this has been on the table in one sort or the other for at least 10 years. That, going back, I know to Larry Warner, that there were discussions, between, he and the Douglas County manager at that point of consolidating health services. So in one form or the other, there's talk, but I agree,
Yes, I remember that from when I was a city employee, and even then it was, like I said, I don't think it's ever come to the health board or the board of supervisors, and I don't know, I probably would start here, but the board of supervisors would also have to make a decision.
Right.
You know, relative, particularly as it pertains to governance. So I just would like to caution everybody that I don't think we should be spending a ton of staff time, and I don't think we have, you know, going down this path unless we have some formal direction.
And there hasn't been a ton of staff time dedicated to this. And within this grant that has been submitted, we did request that any staff time, I said that it would either be Dustin or myself, that any staff time that either Dustin or myself put into it are covered under that grant.
Great, thank you.
And Nikki, were you going to address issue number 5 or defer that for later, the discussion of behavioral health and homelessness?
I can discuss just overview of it. The sheriff had a conversation with Dr. Pintar and I, and this was put on there at the sheriff's request, but he indicated that it is an issue that the sheriff and really a lot of different agencies within the city are dealing with. The clergy are dealing with it right now. He indicated that at this moment, there's not any real major issues. There are some legal things that they're working on, and it would come back at some point to the Board of Supervisors. And I was trying to pull up the calendar, and I'm not getting it pulled up. It should be in your packet. Yeah.
Oh, you did? Okay, I didn't find it.
It's attached. I was just going to try and get it on the screen, but
Oh, there it is. Okay. So those, the calendar of meetings / events are things that we would like all of us on the board to be aware of, to tentatively put into our calendar, just so we know what's coming up. The Board of Health meetings are subject to change, but I'd like to at least have them somewhat set there so that we remember. Thank you.
and the only possible change that there may be is the behavioral Health Task Force. There was discussion at the last meeting that Fridays are kind of hard for people. And so Mary Jane, who chairs that, is going to put out a poll to the members of that task force and see if another day is better. So if it happens that it's another day, I will get that information out to people.
And just as a reminder, we periodically, as a board, get reports from the various subcommittees of that behavioral task force, but I know we're all also invited to attend those meetings as well.
Mm-hmm. Yeah, and anybody can attend at any time. The affordable housing and, of course, the behavioral health, anybody can attend.
Other things? All right, I will entertain a motion to accept the director's report.
I move to approve the director's report as presented.
Motion has been made and seconded. Discussion? Seeing none, all in favor of accepting the director's report, say aye. Aye. Opposed, no. Thank you. It is accepted. We are now on to item 34D, discussion and possible action regarding approval of our strategic plan. Miss Valerie, what do you have to say for yourself?
Good afternoon, Madam Chair, Board of Health. For the record, Valerie Quape, public health educator at Carson City Health and Human Services. I just wanted to thank you for this opportunity to present the strategic plan and where we're at today. This is a 5-year plan. However, as we're going through some of these goals and objectives, you'll notice that some of these pieces end earlier than that. So that we're aware, and prior to some of the conversations that will come up, this plan will be reviewed and revised on an annual basis, and more objectives will be added as current ones are completed. Next slide, please. So just kind of an overview of what I'm going to be talking about today. I promise this will be short. I'm going to quickly go over the process, and then I'm going to talk about the findings and strategic priorities in one and kind of how everything came together. We're going to go over the goals and objectives. There are already some planned edits. Supervisor Bagwell volunteered to review the plan for us and has a couple of things that she brought up, but we are also open to other edits as well. And then next steps. So to start out, last spring, Nikki had each of the division managers do a SWOT analysis with their divisions. For those of you who may be listening and aren't familiar with what SWOT is, it is an analysis of a program or division's strengths, weaknesses, opportunities, and threats. This was done specifically for the programs themselves and within the divisions, not really looking at the organization as a whole. This summer, I met with each of those of the staff within each of those divisions and brought forward their previous SWOT analysis and said, okay, what parts of this SWOT apply to the organization and kind of carry forward? And then are there any additional things that maybe we didn't think about for our division that do apply to the organization as a whole? I then took the results of those analyses and put them out on boards. So there was one for strengths, one for weaknesses, et cetera. Placed them in a public, or not a public, but a open space for staff so that everyone could access it for a week. And they had the opportunity to vote on which things they felt were the most important. They got 3 votes per board. I then took that information, tallied up the votes, and developed some general themes, which were then became the strategic priorities. Next slide, please. So for that initial division to organizational level SWOT, we had several different, this was kind of the representation that we had at each division. You'll notice there was nobody from administration. Nikki kind of stepped back from this and really wanted this process to be more staff-led, and then reviewed the plan essentially when it was completed. Next slide, please. For the prioritization, I did have a sign-in sheet along next to the board, so I did ask staff to sign in and indicate their division so we could keep track of really who had the most say. You'll see we had really great input from both clinical services and human services. Also, because it was left open, administration did get an opportunity to participate as well.
What What percentage is that participation per each of those? Because is 3 or 2 all you have in environmental?
Right.
So that was 100% of their employees.
I don't know if the prioritization is as important as the slide before. Can you go back to that,
Yeah.
Nikki?
So in chronic disease, I think there's 4.
I was thinking, it's about 90%, I think.
Participated.
Yeah.
So while we have high numbers for clinical services, there's a lot more staff in clinical services as well. So, but because they are very, very busy, and this was kind of carved out of their regular clinic time, there was only a few people that could really participate. However, with the prioritization, that's why we wanted to leave it open so that people could come in. If they got there a couple minutes before work or were on a break, they could quickly vote and kind of have their concerns addressed. I think we had just about everyone for environmental health, human services, and that's about 2/3 of public health preparedness, something along those lines.
Well, at that time, it was. Is that everybody? Let's see.
Because that was July.
It was everybody at that time.
Okay.
And then clinic services, that's mainly the full-time people. There are some part-time people that does not cover. And then environmental health, that is all the full-time people. Human
We got
services,
80
all
to
the
90% of
full-time.
the employee participation. That's more what I'm interested in.
Yeah.
Thank you.
And then when you're talking administration, that is myself, then you've got our front desk person, our fiscal people, and that's who's covered under administration. I just noticed when this one says 0, and then you go over here and there's 4. So that's the difference there.
You're welcome. Thank you. All right, next slide, please. So from there, I took the results of that prioritization setting exercise and brought it to the division managers and had them kind of figure out what they wanted as their priority areas and start to set goals and objectives. There were 4 themes that really bubbled up from the prioritization, and so those became the priority areas. I then drafted the goals, objectives, and priority areas and sent them to staff for review and individual feedback via email. I asked them all to contact me directly, just in case they had any questions and they wanted to keep it they didn't want to feel influenced by a supervisor or manager. I received 2 emails with positive feedback and 1 email just asking for a clarification on what we'll talk about soon with the employee development piece, but there was no negative feedback. And then drafted the plan, sent it to our director as well as Supervisor Bagwell, and now we're here. Next slide, please. Nikki? Next slide, please. All right, so now we'll go over our strategic priorities. So here, the 4 priorities that bubbled up were employee development, funding, which we just spoke about at length, partnerships, and communication. So I'd like to note that in 2016, when the health department had its site visit from the Public Health Accreditation Board volunteers, one of the things that came from that site visit report was that they felt that the organization was not just lean and efficient, but too lean, were their exact words. From conversations heard by employees, this was something that really bubbled up as something that needed to be addressed. And so those first 2 objectives really address a lot of the infrastructure needs of employees. We also tried to keep it within things that the organization could handle internally. So you'll notice that when the goals and objectives are discussed, it's mostly things that we can do on our own and don't necessarily require other city offices to participate in. With the partnerships and communication, a lot of that was trying to work on internal processes and other things that the organization could do in order to improve its partnerships and external communication and community understanding of what the health department is and what it does. All right, so now we'll review the goals and objectives. I will try to make this quick. So for employee development, it was felt by staff that they wanted more opportunities to attend trainings, and they really wanted their supervisors to understand really what they wanted to develop with in regards of skills. And sometimes the conferences that are provided by their particular program grants don't necessarily meet those needs. In conversations with the management team, they really wanted something that would be staff-driven and that they could have ownership of, and that to also ensure that they would not be overstepping CCEA contracts or human resources provisions. So this first goal, CCHS management identifies ways to assist employees with career development opportunities. They were looking to identify some sort of program or build a program to help staff achieve their long-term career goals. So that first one, Objective 1, by March 31st, 2020, managers will identify and deploy methods of assessing employee needs related to career development and recognition. So in other words, sitting down with their employees one-on-one and saying, all right, what do you want to be doing in 20 years? And how can we help you get there? And how can we help you get there here so that we actually can retain some of these staff? The measure there is the number of managers to identify and deploy the methods, so we want to make sure that everyone's held accountable. Objective 2, by March 31st, 2021, participating employees will develop a personal career development plan. Participation will be voluntary if the health department moves forward with this, so this will not be something that will negatively impact an employee's annual review. The measure here is the number of employees completing their plan. So just putting it together is really that first step for them. And then Objective 3 looks into, of those employees, how many really start to move on those career plans and the progress that they're making. So the percent of employees activity or opportunity completion. So for example, if there's 10 things in my plan, at the end of the year, there were 5 things I wanted to do that first year and I did 4, then I've got my percentage of 80%. Next slide, please. funding. This is always a fun one. So the management team actually has a process that they're going to be completing, I think it's within this next year, regarding identifying which of their programs really make the biggest impact in the community, so which ones have the biggest bang for the buck. So by May 31st, 2020, deploy the business impact assessment. That is something, and Director Aker can give a little bit more explanation on that.
So what this business impact assessment is it's looking at, in the event of an emergency, looking at all of our programs, and looking at the function level, what functions can be deferred. So we're about 90% done with this, and we have looked at every single function within the health department, and we have decided, so take I oversee chronic disease. So within chronic disease, it has been determined that all of those functions can be deferred if we're in the state of an emergency. So now, next what we will be doing is looking where are our gaps of personnel that we're going to need help from to do other functions if we're in an emergency state. So I can look at those individuals that have deferred functions and then train them for those different skills. And so that's what the business impact assessment is.
I'm no longer certified.
It could.
Nikki, on the, so as part of that, also determining what is statutorily required that the health department do and what you're doing because you have a grant to do it, for instance. Is that part of that?
Yes. So a very perfect example, under chronic disease, we have Ryan White. So we have the Ryan White grant that we have to contact these individuals. We got in touch with the Ryan White program and said, can we defer this function for 90 days if we are in a state of emergency? And their response was yes. So we're deferring that. So we
Right, but-
looked, and then we looked at all of our statutory functions that we do, and we can't defer those. So we've got to figure out how are we going to continue those requirements, and that's all taken into account here.
Right, and relative to the grant, you got approval from HRSA relative to the Ryan White grant. But beyond that, absent the grant, you wouldn't even have that requirement. And I mean, I guess that's what I'm getting at, because the grant requirement in and of itself places requirements on you, but the grant isn't required. Does that make sense?
Correct.
So are you going that granular on this? Does my question make sense?
I don't think necessarily, but I think what we're thinking of, if something happened, we take that Ryan White person and she would now be using her skills to.
Totally get that.
Right.
Totally get that. I'm asking for the next step. And that being, these are the things that the health department is, and Health and Human Services is statutorily required to do. We have to do. Right. And these are the things we're doing because we, as a community, have chosen to do them. The board's chosen to involve us in the Ryan White grant or whatever, but I think we should have a clear understanding of what those two things are, because these things outside of the grant requirements are voluntarily accepted.
Yes.
When you accept the grant money, you voluntarily accept that. But we don't have to accept the grant funds. I guess that's what I'm getting at.
Right.
So I would like to see that. I would like to see that as part of this assessment.
Yes, I'll be able to, so within this assessment, we're going to be able to pull out what are we going to have to do because of, it's regulatory, it's statutory. So what are we going to have to do? We have no choice. And then what is voluntary? And what is also what individuals can be, what functions have been deferred, and what's the dollar amount to that? So if I'm putting them into another function to do another job at a emergency level, what is that budget going to look like? And where am I going to get that money? Because it's not going to be from the grant. So it's going to help.
Well, I
budget
I think it's almost two steps here, because the part about an emergency I get, and I think there's documentation that in an emergency event, there are ways to find funding, and it might even be the general fund, for instance, that has to fund those things because there's a declared emergency.
Correct.
So to me, I guess I'm less concerned about that, because I think in an emergency we understand that there are ways to make that work. What I don't want to miss the opportunity to do is to get a clear picture of what we're doing because we as a community have chosen to do it, or what we're doing because there's a legal requirement. And perfect example for me is the money that we're getting from the state for the smoking cessation relative to vaping. Do we have to accept that money? Are we obligated to accept that money? And if we don't, what happens to the money? So I mean, I guess that's what I'm saying, because again, a grant, if you accept the money, puts conditions on you, but that's not the same as a statutorily obligated task that you have to perform. So, outside of the emergency thing, I'd like you to continue that, but what I'd like to add to it is that sort of an evaluation of what we're doing, what programs we do because we have to do, what programs we're doing because a grant is mandating that we do it, or because we've chosen to do because of a grant.
And I can probably, I think I get exactly what you're asking, and I can probably right now almost show you that, what we have
Well, what I'm saying is
grant-wise.
I would like to see that in this strategic plan.
Okay.
Thank you. No, that's great. I will add that. Okay, so the next objective here is looking at what, given our programs, current structure and function, also programs that would support the work of the Community Health Improvement Plan and the results of community health needs assessments, what would our ideal organizational chart look like? So that the organization has a better idea of kind of what to move towards in the future, if necessary, and if opportunities, and particularly funding opportunities, arise. The third one, by December 31st, 2020, the management team will conduct a grant funding evaluation to identify value-added grant programs and base costs of grant management. So because of this, again, it's really looking at which grants provide the biggest bang for the buck across daily operations, and then how much does it actually cost to administer those grants. So for example, if the health department was to accept a $2,000 grant, it might cost more to administer the grant than they would actually get value out of having the grant. By July 31st, 2021, CCHHS will continue to support, as allowed, legislative efforts to improve state public health funding of local public health agencies and programs. So the measure there is really the number of support actions taken by the management team and employees. This is not lobbying, but there are other ways to provide education that is appropriate for persons housed in the health department.
So for the record, Nikki, the only thing I would say on objective number 5 is I would remove based on the results of the business impact assessment, because that's not tied to the business impact assessment.
What is it based on?
This will be based on looking at our department and because the business impact statement is looking at that emergency situation, and this is going to be based on what makes sense for our department.
I think I think the point, though,
It's
that
two
they're both
separate.
they're separate, but they're interrelated. If
they are.
you might have a red box around the mandated ones, or you'd have your
Nice to have.
organizational chart, but you'd have a red box around the ones that we absolutely have to do. Is that,
Correct, but the way this business impact assessment is set up, it's definitely keying in on that emergency situation. I think I can pull information from that, but it's not based solely on that.
No, I agree. I understand, but I think that
Right.
what I'm hearing is that we want to know what to use the national phrase, core essential functions would be, and how we can do those.
Can I ask why the business impact assessment wouldn't have two parts, the emergency part and the everyday operational part? Maybe I don't understand what a business impact assessment is, but what would be the harm in creating a business impact assessment that deals with part one, how we operate in an emergency environment and what impacts to organization are there, and part two is the business impact assessment on how we do business based on statutorily mandated items and elective items?
So we have a contractor working on this. I can definitely reach out to her and see if she can do that. Her expertise is public health preparedness.
Okay.
So I can definitely reach out and see if she can do that. I don't know if she has that expertise.
Okay.
But I definitely think I can use that information from it to help.
Yeah, well, you have a lot of smart people around.
Be
too,
a
so-
part of that information and add to it.
Okay.
And just as a clarification, it's my understanding from my discussions, this is actually something that is being implemented within the Public Health Preparedness Division, and it was a part of Public Health Preparedness funding, which is why it's emergency focused and not day-to-day operations focused. But we can definitely.
Well, perhaps as you,
Objective 5?
as you deal with it, maybe move it into objective 5 and you can, you can
Paying for what?
create a deal organization, maybe based off of an internal evaluation of statutory objectives versus elective, you know what I'm talking about. I mean,
Well, and I want us to avoid, I really want us to avoid the term of things we want to do as much as, because we've made a concerted effort over the past 5 years to pursue grants based on what we see the community needs are.
well, yes, I'm saying what we want to do just for the sake of expediency, but yes, this board has accepted
Chip-based.
money. The Board of Supervisors has received and accepted money based on the chip, and I'm fine if that's the focus. I just, again, I think we should have that, a clear picture, because their org chart should be based off of that very thing. Because the chip is telling us what the community wants, and so the org chart should be based off of something. So I'm suggesting that those are the things that we look at,
The chip.
is the chip and what the focus of the community is.
Yes. And objective 5 is not charged and funded out of the preparedness grant. Objective 4 is tied to the preparedness grant. But objective 5 can do, I think, what Stacy's after, and I agree it should be based on the chip. Because that's supposed to be, our gap analysis was a piece within the chip anyway, where we went through and said, where are our weaknesses? What do we need to
And I'd like to have
address, which should be organizationally what we're trying to address.
But we should also have the statutorily
Oh, yes.
required component in there as well.
And I would say based on the CHIP and the needs, the community health needs assessment.
Yeah.
Yeah,
That's fine.
both those documents.
Yep.
All right, I think we're ready for the next one. Okay. So moving on to partnerships. So again, this is now turning our attention a little bit more externally. Goal 3 is to identify new non-traditional partnership opportunities and communicate existing partnerships across divisions. So some of the conversations among staff that went along with this was everyone gets so busy within their individual programs and then communicating within their divisions. Sometimes they don't necessarily share partnerships and contacts that they have across the organization as a whole. And while that has been improving, staff feel that there's still a lot of room for improvement there. So by June 30th, 2021, identify partner sector gaps for the organization as a whole. So who are we all working with? Who is the primary point of contact? And what are the other opportunities for other divisions? By June 30th, 2023, engage new partners to fill sector gaps identified with that previous objective. Because we don't necessarily know where those gaps are just yet, that's why there's not any specific, like, oh, we want to have 90% of our gaps filled, because we don't know what that would actually look like. This is a little bit more exploratory.
So on this one, I'd like to see something in here about maybe an additional objective, or maybe you can include it in, is that 8, 5, 6, 7, 8? You're looking at gaps within within the health department, but I think I'd like to see it a little more holistic, maybe, in looking at gaps within the city as a whole. So one of the complaints that I had when I was still with the city is that state health would go out and do things that had already been done by the fire or law enforcement or emergency response communities. They would go out and literally repeat something that had already been done. And they would do it in a different way, and they would, not partner. So it really creates silos, and I don't want that to happen. So I'd really like to see that objective ensure that there is an evaluation of those partnerships within our local government.
I think that they can address that from the health department perspective, but you bring up the larger point is the other departments probably should be doing something very similar.
Well, I guess what I'm saying is that.
Integrated.
Yeah, I mean, that as it pertains to the things that they're doing in public health.
Right.
Or in health and human services in general, they should examine what other agencies within the city are maybe playing a role in that and how they can integrate. I think it speaks to this strategic pillar or overall arching goal, and I think it speaks to the next one as well. So I think you can come
The
up with
example
something.
that comes to mind to me would be code enforcement. That, we have health inspectors who have code violations and then there's other code violations that happen. So I think if I'm interpreting what you're saying right, kind of making sure that we're not doubling work.
Yeah, I mean, that's exactly what I'm saying. That, there's that the plans that they're developing for whatever emergency they're working on are integrated with the city's overall emergency action plan. And the fire department just brought a message or a grant forward today to do the hazard mitigation plan. That's another item where, we need to make sure that the health department has a seat at that table so that the health items can get mitigated as well. So I just, you can come up with some language for that.
I think, Valerie, you might identify, when you say identify partner sector gaps, maybe include language that says partners can include other city agencies or external something or another.
Internal and external.
Internal and external, yeah. Because when I see partner, I think of somewhere else, and I don't necessarily go directly to another city agency, but I think I should.
Well, the way it's worded to me, it says identify partner sector gaps for the organization as a whole. To me, this is the Health and Human Services strategic plan, so they're identifying those gaps within the health organization. I would just ask that the organization be expanded to be citywide. So, identify partner sector gaps for citywide or within the health department as compared to citywide. Or again, what I'd like to see is maybe, well, anyway, I think you can come up with some language.
And Supervisor Giommi, I like adding that in here, and I would say that since I've started, we have a very good relationship, and I do have a seat at the table, with fire, with emergency management, have that voice. We have a very good relationship with the sheriff's office, so those partnerships are being developed and built. And so I have seen great improvement in that area, but I like adding that here too.
And I'm wondering if maybe that's a project that we can work on with the city manager's office as well, as far as identifying proper language and how to attack that. Okay, moving on. All right, so last but not least, communication. Goal number 4, CCHHS improves internal and external communication to facilitate program awareness and community health literacy. So a lot of the discussion that went into the development of this priority area and this goal was staff at all levels felt that the community doesn't really understand the health department, doesn't really know what they do and what our purpose is. And also helping improve health literacy also helps improve community science literacy. So there's some opportunities there to kind of help people understand how health works a little bit better so that they can help keep themselves healthier. By June 30th, 2020, CCHHS will deploy an updated 508 compliant website that improves information accessibility. The purpose of 508 compliance is to improve the accessibility of the website for persons with disabilities. And so that you'll notice that there's something on the planned edits slide about that as well to help clarify that purpose. By June 30th, 2020, CCHHS will collaborate with Carson City Human Resources on health-related articles for the citywide newsletter. There are quite a few community members who work here, right here at the city. And so it was kind of a low-hanging fruit to see how we could better partner with human resources to communicate out the programs and services that the health department does provide, and also start with some health literacy projects there as well. And that's not to target them specifically for any reason, just easy access.
They're there.
They're there. By December 31st, 2023, the management team and staff will work to build and implement an internal communications plan. So in regards to internal communications, there's a lot of different strategies that have been tried. Nothing's really stuck, so to speak. So we've tried newsletters, we've tried various other things, having a organization-wide calendar. So really trying to experiment with something that works for all staff. And a part of that is we have some staff who are always at their desks because they're program staff, some staff who, for example, that work in the clinic and they're not at a desk all day and they have very limited time. So how do we get something that really works for everyone that also isn't a heavy lift to keep updated? Because that's the other piece, is we don't necessarily have staff that are just communications. Moving on.
Can I ask you just a question that came to me on the newspaper? You guys do healthy articles or something. You tell me how much feedback do you get, public feedback on your articles?
Not much. At all. So that is something, it does not cost us anything. And sometimes we hear that an individual has read the article, but it's not a lot of feedback.
Oh, maybe we can, I don't know, but excuse me, maybe we can work on something that makes it interactive, that you're going to know that your message is getting read or that something is happening. I don't know. We can talk about that, but when you look at communications, I think it's important that you recognize whether it's of value. Because that's a lot of time and energy for you also.
We have went more the social media route. And so we're getting feedback on, do we get comments? We can tell who's liked the page. We can see who's, so we now have a social media post every day. And we have it planned out which program has it for every day. So we put time into that now.
If I could insert here, I'm glad you're doing that, and I think it's important that you do that. But I wouldn't say that the lack of feedback from other types of communications means they're not being utilized. I for example, look through the Health Wednesday and the Appeal, and I think that you can, it's like a recording. Once you've made it, you can do 50 copies and send them out to everybody. Not everybody will use them, but I fear that we're falling into an area where social media is everybody's go-to and the other media is getting ignored, but I don't think that necessarily is not being utilized, put it that way, especially when we have an older population in Carson City than in the rest of the nation.
Thank you for that feedback.
Stacy?
On the objective 10, I guess I'd ask Nancy or Stephanie, I'd ask IT if they were here, why would we just have one department doing an updated 508 compliant website and not the rest of the city? I guess I kind of have an issue with one department going off and having a website that doesn't match the city's websites. Why wouldn't we have something cohesive? Sorry.
I can't remember what the 508.
The answer is they
people with
should, right?
disabilities.
Yeah, that's my point, I guess.
I will talk with IT and.
I would just like to, I don't like, it bothers me that one department would have a website that looks different than the rest of the cities. We're a cohesive unit, we're one level of government, we're one body of government. It shouldn't look like the health department is a different part of government or the public works department is a different part of government. I mean, for me, I very much believe that we should have some unity there because we should be unified. So that's my 2 cents worth.
And Stephanie just let me know that we are doing a website refresh soon.
Okay, so, I mean, that date may be a little bit different than fluid, because I'd like to see Objective 10 match with the cities as opposed to having just one department off on their own.
So to clarify, the 508 is the just disability, and basically, ideally, all the cities' websites would be compliant. Is that the goal, or can you speak to that?
Thank you, Stephanie Hicks, Deputy City Manager. That was not the initial intent of the website refresh, but it is something we can certainly include as we work forward on it.
I mean,
Why you wouldn't?
yeah.
I don't understand why we would refresh without bringing it up to the disability standards. I mean, that's the whole objective. But can I ask, is it two separate websites, though? One, it's the health department is through the regular city website, and you do look the same, but then this one is, did you mean for Get Healthy, Carson City, or?
So our website,
Links off.
our website can be accessed through the city's website. It was even, years ago, it was even hosted by somebody differently. We actually pay an individual to update our website.
Not
So
through our
it's not-
IT department,
no,
that's what I was trying to
it's
get to. I
different.
thought I remembered it's, Stacy's right, I think, where he's saying our city logos, headers, website should match, and I agree 100% with him, but I also agree with him, it's a separate issue that they should all be 508 compliant, so. But you are hosting and it's not IT.
It's not
that's
IT.
doing this website,
No,
so it's got to be
it's
brought
an
to,
expense that we
right.
pay for within the health department, and it, like I said, it can be accessed through the city's
But it's a
website, but
separately
it
hosted
is
site,
totally
right.
separate.
Okay, so, thank you.
The logo and the messaging is not different from the city.
It is. It's Get Healthy, completely different. That's
Right.
what we're
Well,
bringing up.
well,
I'm not saying that what you have on there is bad. I'm just saying that we're one local government. We shouldn't have one department having to go out on their own and pay someone to manage a website. Because the website that the city has can't be managed properly, so. I'll leave it at.
Don't we have I think we have lots of the departments uploading to the website. I think we have issues there anyway. I think you might be right, but I'm going to be shocked they're not the only one updating.
I'm sure they're not. I'm just stating a broad statement, and maybe I'll save it for the next board meeting under comments.
As we used to say in the news business, in the midst of communications, there is chaos.
You done? Because I have more questions too. Do you have more?
I do have
Okay.
some more slides, and okay, go ahead. So some of the planned edits that I had previous to this meeting, we found a typo within the plan itself regarding the partnership graphic. There was something that was copy pasted over, so I fixed that within this presentation. And then also there was a sentence structure issue found on page 9 that will be fixed as well. I was going to go into further explanation of 508 website compliance and what that means. And then also clarify the language regarding the part-time staff hired to complete the process. That was me. The health department received a $9,000 grant to do the strategic planning. And it was more cost-effective to hire me on part-time than to put it out for bid for contract. I'm cheap. Is the short one there?
Valuable.
So as far as moving the process along, it was kind of the biggest bang for the buck to do it that way. And then,
just if I can add to that, so this is it's a small grant that I get from the state, and it is for accreditation purposes. And so I have used it for Valerie doing the strategic plan. I have used it for another individual working on projects. You know, I continue to use it for accreditation type purposes. It doesn't look like that grant funding is going away, but it is a very small grant. And I'm very appreciative to have individuals like Valerie being able to work on these projects, because it would be very expensive to hire out a contractor to do that. Just, you know, we don't have the internal resources to do it.
Much more eloquently put. Thank you. And then also additional edits as are decided here in this meeting will be included as well. So the next steps, when the plan itself is approved with edits, then it'll be finalized and published to the Health Department website. I'm currently working on a dashboard to track each of the measures associated with the objectives. That will be in Excel format and will export to some nice graphs that can be easily cut and paste into presentations for future use. So the purpose of that is really to take a lot of the reporting load off of department staff and make it easy to keep up with everything. So this is not just a plan that sits on the shelf and gets around whenever we have time to do it. You'll also notice that the goals and objectives and priority areas of this plan are a lot fewer than the previous strategic plan. That was on purpose. The previous strategic plan was our first, and we didn't know what we were and were not going to be able to do. It turned out to be too big of an animal to really tackle for anyone's resources. So we were very careful in the number of objectives and priority areas that we included in this plan so that it would be a lot more feasible and not overload staff that are already wearing sometimes several different hats. Data will be reported out, and then again, this plan will be reviewed annually and revised as necessary with new objectives added. Next slide, please. It's my contact information. I do have a carson.org email address. However, the other email address is better to reach me at, and that is my work cell, so I can be reached at that number at any time, including text. And with that, we will open it up for questions.
Other comments? What?
I had this conversation with Nikki yesterday a little bit. I understand that the strategic plan is mostly an internally focused document, and we have community-focused documents, the CHIP, the Community Health Improvement Plan, but I'm slightly troubled by the lack of community-focused objectives in this document. I don't have any great suggestions for what you could include, but if I were a citizen and I picked up this document and looked at it, I would say, well, they're not doing anything for me. They're only doing stuff for themselves. Mm-hmm. And that may not, I get that that's not a fair assessment, but I think it's a fair conclusion for someone who looks at it from the outside. I don't know if I'm the only one that feels that way. I'd like to hear what the rest of the board has to say. And I hate to be critical without having a suggestion for improvement, but, you know, perhaps adding another strategic pillar about, I don't know, maybe increased immunizations, maybe, I don't know what the answer is, but I just wanted to throw that out there as a concern. And if I'm the only one who feels that way, I could vote for it with the changes we had today as is, but I wanted that brought up for discussion.
On the slide or the goals in the section where you had partnerships, I think that we have an opportunity there to add kind of what I think Stacy and I were going for there, hits what he's just talking about right now. And so I pictured that as giving me some gaps, and then you could add another objective that would say, how are we going to fill these gaps? And those are external partnership gaps, because I think he's right. So one, identifying them, and then you're having another goal, because this is our 5-year plan, and even though we're gonna update it annually, I think we could add another objective in there that says, take identified gaps in our plans and our partnerships and give it a 1 year later, how are we gonna fill those gaps? What are we gonna do with the partners? And maybe it is immunizations, maybe it is, but I think we need to know.
It's that last part you're talking about that I
Yeah.
feel strongly. I think Stacy does.
Could we maybe rename this community and internal partnerships?
Yes, I like community
So if
instead
we
of
change
partnerships.
this to community and internal partnerships,
Yeah.
add an objective or two relative to community partnerships.
Yeah.
And I'd also like to suggest that we restructure it so that partnerships is the lead goal. It's just a matter of reorganizing and renumbering.
Right.
It
Drives an emphasis.
as a
Yeah,
public,
right,
as a
yes.
public service agency, our primary focus should be our community. I strongly believe that our community should be our primary focus. I completely agree that a secondary focus should be on those people who serve the public. The way this is written, I don't see the community focus taking priority. I see employee focus taking priority. And I have a problem with that. I don't have a problem taking care of our employees, but I have a problem with the appearance that we're only taking care of our employees and not our community. So I don't know if I'm making sense, but if we change this to community and internal partnerships and add 1 or 2 objectives relative to the community part, I could absolutely support it. And I would even, I know you need approval. I think we could probably bring it back with the proper motion to the Board of Supervisors to approve it at a meeting so that we don't have to have another Board of
not the
Health
health
meeting to do it. So I think if we craft a motion that says something along the lines of incorporate the changes that were done today, staff makes updates, and that the Board of Health grant the Board of Supervisors authority to approve the plan. That way, we don't have to wait for another meeting to do it, and you can get back on the path. So I would be very comfortable with that.
If I could weigh in, since you asked a question, you're absolutely correct. And it's not just a problem here. You talk about the specifics. I think you've done a wonderful work product, but this has been one of my really pet peeves about government from both sides of this dais. And that is, it's true of all people. It's a human trait. Warren Buffett plays bridge with Bill Gates. I mean, people are internally focused in, this is my group, we do this, et cetera. And I've said this for a long time. One of my problems with the way that we work as a group, as a government, is that we take care of our own selves as a group. There's 500, 600 people who work for the city, and we talk to each other. That's just normal human behavior, but you've hit on a very important facet. We all know we're working for the community, but we've got to make the community understand what it is we're trying to do. And when they see us internally focused, they're just, well, I don't want to point to any other capital cities in this nation at the moment, but I think that's going on there too.
So if I may, and please don't shoot the messenger. So the focus of this was brought forward from employee conversations, and I get that. I think you have very valid points. However, you have to remember that this is an organization that has been continuously asked to do more with less for years. And the employees are tired, they're burnt out, and they feel that they are not valued by this board.
Well, I can tell you that every department director in this city can sit there and say the exact same thing. And I don't think the health department stands out in that regard. This has always been a community that has operated in a lean fashion. It's always been that way. I suspect it always will be that way. I don't think anything that was suggested here today changes what the employees have brought forward. I didn't suggest one time taking out the funding component. I didn't suggest one time taking out the employee development. So if the employees have a problem putting the community first, then my suggestion is they should find someplace else to work.
Amen. And we do value them. That's not the point of what he said or what I said. We do value them, but we work for the people. That's that simple.
Well, I'm just going to go on the record to, I'd rather change the subject a different way and just thank all of the health department staff for their very valuable service. And I think each and every one of us here would say that we know they do a lot with little. And I look forward to seeing whatever the gaps are and whatever things come from these, that we can continue our community service. And I know that that's the same goal that each and every employee has. And just rest assured that we all have the goal of having happy employees too, because then they provide better service. So I think we're all really saying the same thing. So please pass on to your staff how much we appreciate them. And Merry Christmas to them all.
I think that we can make some appropriate edits within, I would suggest that within the partnership, and perhaps do some reorganization of where things appear. I don't think we have divergent goals here. I think we have the same goal. It's a matter of how we put it together. I need suggestions as to how to structure the motion so that we don't have, oh, you do? Okay.
Give me a second. I move to direct staff to update the CCHHS strategic plan, incorporating the input received in today's Board of Health meeting, and to authorize the Board of Supervisors at a future meeting to approve the strategic plan.
Dan, will that work?
My reluctance to answer that wasn't based on, I don't think that'll work. I was just kind of chewing that over in my mind. Just wanted to make sure that there wasn't going to be an unlawful overlap of authority between the two different public bodies. In general, though, I think because that's a designation by this board to the Board of Supervisors, that should be all right.
Okay. Is there a second to the, you did, thank you. Any discussion thereof? Still wait? All right, hearing no further discussion, all in favor say aye. Aye. Opposed, no. Motion carries. Let the record reflect that Sheriff Furlong joined the meeting and said thumbs up.
Thank you.
All right, where the heck are we? Oh, final public comment. Okay, public, that was your chance. We will adjourn until March, somewhere in there. Thank you.